Good morning, everyone. I'm Dr. Allison Arwady. I'm the Commissioner at the Chicago Department of Public Health. And thank you for joining us for Wednesday's edition of The Doctor Is In. Today we have a special guest. This is Alexa James. She's the Executive Director at NAMI Chicago. We told you yesterday that today would be a day we would especially have a lot of focus on mental health, which has been something we've been talking about all along, but it's really top of mind at the Chicago Department of Public Health and really throughout the city. So just a reminder right from the beginning, start putting in questions that you have related to mental wellness, specific situations, anything that you've got that you have questions in that territory, we have an expert here. So just to start us off, can you tell us just a little bit, for those who aren't familiar with NAMI Chicago, about what you do and what you're doing now?
Thank you, Commissioner, and thank you so much for creating a conversation around mental health always in everything that's been going on. You've been such a champion of this issue. So NAMI Chicago is an organization that supports people who are trying to connect to mental health resources. And we really think about mental health resources away from just the clinical care. This includes housing, this includes legal services, this includes support just over the phone, benefits, et cetera. And so the skeleton of the organization, or maybe now I should say the backbone of the organization, is really our helpline. We are set up virtually now, which is super helpful. Individuals can call us and request resources that they need, talk to somebody who's a clinical social worker for free. Insurance doesn't matter, and as long as you need support. We also provide support groups and training of first responders, and generally really wish that the stigma of mental health is reduced. And so in everything that we do, our efforts are to normalize mental health.
Okay, wonderful. And chicago.gov/coronavirus, as always, that's your landing page for all things coronavirus in Chicago. And there's a bucket on there that is specifically about mental health. And if you go in there, you'll see the very first hotline that's listed is for NAMI Chicago. We partner a lot with NAMI Chicago, even outside of COVID. And so where people call 311 to get connected to a mental health specialist, it actually does get a connection through the NAMI helpline. Last week we had Pastor Chris Harris from Bright Star Community Outreach. There are a number of these groups that are doing this, but that's why really thank you for all the work you've done over the years and really stepping up. So we'll come back to Alexa, put in some of your questions, but I will spend just 5 minutes or so doing the numbers update and highlighting where we are as a city. So as of now, we stand at 5,511 lab confirmed cases of COVID-19, as well as 140 deaths in Chicago residents. And that was an increase of 468 cases and 22 deaths since the prior day. And if we look at how that fits into Illinois, so Chicago's at about 5,500 cases among the 13,549 in Illinois and 140 deaths of the 380 in Illinois. In the US, we're up over 375,000, and in the world, we're up around 1.3 million. And we talked a whole lot yesterday about the data. For those of you who were with us yesterday, we really dove in on some of the differences between case numbers and case rates and helping you understand some of the data. So if you go to chicago.gov/coronavirus, always up at the top is latest data. And that's where, again, every afternoon we put in a lot of details, demographics, geographic information. Let's take a quick peek just at our two graphs. The first one is showing, again, all of the positive test results coming back for Chicago residents. And as always, I'll remind you that we count the test results here by the date the test was done. So that's why sometimes we get a lot of questions about why is the last day, it doesn't seem to match on numbers. It's because it can take some time for test results to come back. And so we count them based on the date of test result. And so the reason some of the bars look lower on the right is those are still days that we're having pending tests come back. And then let's look at the second graph. This again is our basic curve. And I do want to note, we're seeing an increase there, but we absolutely are seeing some real bending of the curve. I think in the next couple of days we'll show you some graphics that show some of this, but we've moved from very initially, we were seeing a doubling of cases really every day or two, and although that may not sound as scary where you say, oh, 5 cases one day to 10 cases the next day, or 10 cases to 20 cases, that doesn't sound as concerning to the general population where the numbers seem low. But as the epidemiologist, a doubling every day or every 2 days is on a trajectory that's on, you know, the very steep curve that would very quickly overwhelm our health system. And so what we've seen is, first we saw some flattening of that, particularly sort of as the stay-at-home order was coming into place, where we went to a doubling every 4 days, and then really moving out from that. We're about 18 days post our stay-at-home, not Chicago's, but Illinois' big stay-at-home order. And we've talked about how it takes a week or 2 weeks to see that effect, and we're seeing that flattening. You know, we went from doubling every 4 to every 5 to 6 to every 7 to 8, and we're really now at a doubling in the kind of 8 to 10 day range, which is really good progress. However, if you think about what a doubling every 8 to 10 days still means, it means if we're at 5,500 cases right now, doubling in 8 days means that 8 days from now we would have 11,000 cases. And so that, I want folks to know we're making really good progress, but it is not a time to lighten up on this. And that's the most important piece. We've talked about this. April is like our month of truth in a lot of ways here, in terms of how well as a city and as a state are we going to do with that bending the curve. We need to get to a point where we stop talking about doubling on the way up to really getting flat, and then actually seeing that come back down. So all the work that you're doing to stay at home as much as possible does save lives, does help keep our health system from being overwhelmed. And to our essential workers who need to be out, thank you. Everything that you're doing, you know, to really keep the social distancing, to be doing the hygiene, and everything that we can be doing to protect our most vulnerable residents. We talked yesterday, but it remains true in our data today, that if you look at our deaths, about 18% of the city is over the age of 60. But about 71% of our deaths are in people over the age of 60. Again, just pointing to that risk factor of age. 95% of our deaths have been in people with these chronic underlying conditions. So diabetes, hypertension, heart disease, lung disease, those are really leading on that, where we look at, you know, really sadly, the people who have already lost their lives here in Chicago. We are seeing men with a higher death rate than women, similar to what we've seen around the world. And then, as we've been talking about all week, really very disproportionately seeing deaths in the African American community here in Chicago, about 71% of our deaths if we look today. And so lots of conversation yesterday, lots of conversation coming on that. I want you to know that on Friday, Candace Moore, who is the city's chief equity officer and is really leading a lot of the rapid response work related to some of the things we're very actively doing as a city, continuing to make sure that we're getting resources and outreach where they're needed. So that'll be some conversation on Friday. So I think with that, let's turn a little bit back to some conversation about mental health and about NAMI. So tell me a little bit about what your folks are hearing as they're picking up the hotline, what kinds of questions are coming through, what kind of support are you offering? Help us understand that a little bit.
I have to give a huge shout out to my team.
Yeah.
We mobilized really quickly. Nobody is on hold. It's not going to voicemail. It's pretty incredible. And I say that because our call volume is up at least 40% at this point. So we're seeing a mix of things. You know, NAMI historically was a place that people would call a family member, an individual, or a professional who is trying to support somebody living with serious and chronic mental illness. We have shifted away from that and are still inclusive of that, but are talking to people who are generally distressed. This is a really hard time for everybody.
It is.
Nobody is. I think that there are some people who feel validated by this experience because they've felt isolated for a long time, or they've felt very anxious and nervous about health issues, this is hard for everybody. So we're seeing our call volume increase for just support calls, meaning people are just calling because they need to chat. And then we're doing follow-up with them. Some people we're talking to every single day and doing grounding exercises while we are connecting them to telehealth or to a city clinic.
Yep.
So I want people to understand that even though there's a stay-at-home order, there is still access to mental health services. The city has made this a priority, and we are still able to connect people. The other thing that people are calling about really is benefits. There's been a tremendous amount of job loss and housing instability. There's folks, so we have kind of reframed and thought about the way that we're having conversations with individuals on the phone to make sure that their safety, to talk to parents about how stressful it is to have kiddos at home while they're working or not. I should be doing more work with my kids, I know. What we know about mental health is what maintains stability is stable housing, access to your community, purpose, your work, and access to healthcare. And in an instant, all of those things have changed for people. And so what we're trying to do is make sure that we're assessing how everybody is sitting in that and then creating resources for them. And then we're also seeing a lot of callers who are just trying to navigate the healthcare system in this new space. Like, do I go to the hospital? A lot of fear around that too. And so we're supporting those crisis calls as well.
And tell us a little bit, if someone calls in, I imagine you're getting a whole range of people who have never called before versus people who may be very used to getting support, or people who may have even more needs. Talk to us about what happens when somebody calls.
So when you call, you can call through 311, or you can call directly to our number, which is 833-626-4244.
And that's on the website. You can call directly, less wait time, etc.
We're open 9 to 8 during the week and 9 to 5 on the weekends. What you can expect is to get a pickup initially. There will be no toggling. So there's no press 1 for this or for that. You can either speak to a peer, so an individual who's living themselves with a mental health issue, who's made this their work, or a clinician, and you can ask for that support. And we have a conversation about what's going on with you today. What are your strengths? What are you looking for? How can we support you? And what we really do is problem solve. We really look from a system perspective. We are so privileged that people feel that they can reach out to us. My vow to you is that we're not going to make this experience a bad one for you, and we're never going to leave you with no, there's nothing we can do. We will figure it out, and we will maintain connection to you.
And do people need insurance? Do they need, what do they need to call?
Just a phone. Just a phone.
And we just got a question, is NAMI free?
We are free. We are free. No insurance needed, although we're going to ask you about your insurance, because if you are not insurance connected, we want to help get you insurance connected, because we are a stopgap. We want you to be able to connect to long-term mental health resources. But yes, we are completely free, and there's no time limit to our call. My staff gives me a lot of grief because my calls tend to be the longest, because I just appreciate this connection so much. But we typically spend about 15 to 20 minutes on the phone with folks.
Okay, great. And I know one of the places, if there are people who really are needing some more intensive sort of support, or particularly if they may already have mental health issues and are not connected to a clinician, I know sometimes you'll refer them to the city's mental health clinic. So let's talk about that.
What's nice is there's now a central intake process for the city clinics, which has been really helpful. Access to psychiatric care and med refills. We're asking everybody if they have access to their prescriptions, and if not, coaching them on how to talk to their doctors about this. And because of our relationship, the city's been really helpful in figuring out how to negotiate people and access. If you are having a difficult time getting to an appointment because of transportation, we will support you and provide transportation for you to get to your appointments. And there's a lot of clinicians now who are able to do teletherapy. I think that what was great about state leadership is some changes in rules around Medicaid reimbursement. So we have a bigger workforce in a sense.
Exactly. And again, on the website, the Chicago Department of Public Health, has mental health clinics. We were very glad that we had done some of the pre-work around telepsychiatry and really thinking about what some of that would look like even before this. And so we do have availability there as well. The number is 312-747-1020. But again, kind of on the website. If you call into NAMI and there's additional needs, we're just one of the places where that's being provided. But, I told folks here, my sister-in-law is a social social worker, and she regularly, she sees especially kids who have all sorts of needs, and she has moved for the first time to a tele platform, and the work that had to be done with insurance and everybody else to make that happen. But we've really seen people across this city stepping up to try to figure out how to make sure people are getting not just physical but mental health support in new ways and with new technology.
And it's uncomfortable. Not everybody's super comfortable with this like teletherapy.
Yes.
However, this is a place where we're all uncomfortable generally, right? We all right now have to modify the way we behave in order to become accustomed to this new environment. So I would say push yourself a little bit in the discomfort zone. If it's helpful for you to have somebody sit with you while you're like dialing in and getting used to this platform, and you do not have to use video. You can do just over the phone.
Same thing for at the clinics, et cetera.
Right.
Yep. Okay, good. So here's one. So how would you recommend Chicago parents talk to children about mental health or maybe support their children during this?
That's such a good question. Yeah. I was just having this conversation with my kid's dad the other day. I think it depends on their age, right? What they can consume. We know that overconsumption of news can be very anxiety provoking, particularly if we don't know the outcome, and it can become contagious. So the one thing I would say is, as a parent, make sure that you're approaching this very level-headed and confident, because they're going to look to you and social reference you to think, is everything okay? Because if mom's okay, then I'm okay. So think about how you're having these conversations with your girlfriends or your spouse about these, and know that they're listening. I would say, I would talk about safety and that they are safe, and these are ways that they can maintain safety and give them some power over that. Like my 3-year-old knows now she washes her hands like this, and I think that's helpful. I think that you sit with that discomfort too. I don't think you make promises to them that, oh, you'll be back in school here, or oh, you'll be able to see your friends. Say, these are really uncertain times, and I think we should keep having a dialogue about it. So being really open and transparent, and per age group, there's obviously going to be different suggestions, but feel free to call our helpline and we can coach you through those conversations more in depth.
Okay, great. Yeah, and we've talked about on here, especially if you think about different ages and what they are seeing, especially images. So we've talked about trying to not have the TV on all the time, and especially if there's kids, with young kids, really trying to not have them see that. With older kids, where we know they are seeing it, having conversations about it, helping correct myths. Again, I think that's good advice around this safety piece. We've had a number of questions sort of from parents writing in kids, questions of, is Santa Claus safe? And are they, like things you don't necessarily.
The tooth fairy I got the other day. It's the tooth fairy social distancing. One of my staff's kids said that.
Yes, we declared yesterday, the Easter Bunny and the Tooth Fairy not only as safe, completely safe because of their magical powers, but as essential workers. So
that's right. That's very good. Yeah. Well, and I think thinking about it from a fear-based perspective, we don't want to include fear. So I was very excited when my daughter said the other day, Mom, if we don't brush our teeth, we get coronavirus, because I thought, oh, that would be a good way to get her to brush her teeth. But I have to correct her and say, because we don't want to start creating fear with our children that it's that we don't have control over our health in this particular situation.
Yeah, absolutely. Catherine here is writing in saying, great words, anxiety is contagious.
Yeah.
How do we prevent the spread?
I'm telling people to limit their time on the news.
Yeah.
I mean, the way that our news is typically broadcast is typically in this urgent cadence, right? I mean, that's why people tune in. So we tell people to limit their time. We think about, if we're working in teams or we're continuing to work, how are we setting the tone? Because also calm is also contagious.
Yes.
So thinking about the fact that we can have these feelings, and then how are we reacting in a way that infects folks around us. So when we think about general anxiety, we know that it can build and it can become cumulative, and we want to try to reduce that as much as possible. And that's why creating a coping strategy or coping plan, thinking about building resilience through our support, through clinical support, is going to be really helpful.
Yeah, and we've talked about sort of the importance of trying to maintain some structure in your life as much as that's possible, where routines often are totally disrupted, and it can be hard to feel like you have control over your life in some ways. To sort of put some of that back in, I think, can be really helpful. Yep. Okay, what about healthcare workers during this pandemic and their mental health?
I mean, these are our frontline first responders, our heroes, as are our first responders. Part of my concern about healthcare workers is that they don't necessarily have the space to process, that we are working in this adrenaline-filled space. And so we want to make sure that we are honoring the fact that they are seeing the worst of the worst, the most tragic, and that their mental health is super important, and they can't be of service to others if they're not of service to themselves, right? We say that all the time. So we're offering some free support groups for healthcare workers with the support of the city. We want to make sure that we are available to them when they are needed. But I would say thank you. If you're feeling powerless over the situation, you feel like, what can I do? Reach out to a healthcare worker, thank them, reach out to your own primary care physician. My sister's an emergency department doctor, and we don't even know the half of it, of what they're seeing every day and the pain that they're experiencing. So they're holding a lot of that for us.
Yeah, and one of the things that we're actually, obviously we continue to work really on the website, not that the website is the be all and end all, but it is a place where we are trying to organize resources, and we're doing, I think in the next day or two, really a section specifically for healthcare workers, pulling together all of the various resources, of which, how they fit in on everything from the child care support to the mental health support to the financial support, where people can kind of plug into transportation pieces, et cetera. So.
And for healthcare workers who are listening, when you're not working so hard, this is, obviously, as we all know, working in a space where we're constantly stressed all the time is like our stress response system becomes overactive, and it can lead to all sorts of stuff. So if you can find space for yourself to do some yoga, there's so many good free online yoga classes right now, to take breath, to think about between work and home, how you're decompressing, it could be really meaningful for you.
Yeah, and we've talked about sort of, there are apps, there are ways, but anything that you yourself find calming and relaxing. So whether that's sort of a yoga, whether that's a prayer, whether that's meditation, whether that's reaching out to a friend, having a list of some things that help you feel grounded and help you deal with some of the anxiety that is just high across the city and really across the world in a lot of ways right now makes sense. All right, let's get to some more questions here. Okay, so here's one more from me. Carolyn Carr from Facebook. Is it safe to go outside if you practice social distancing? Yes. So we've been answering this really every day, but we'll keep answering it as questions come in. It is safe to go outside. It is, in fact, even good to open your window, to get sun in, to be stepping outside. We've talked about wanting people to be getting their heart rate up and getting some exercise in, but we want you doing that in ways that do not bring you into close contact with people outside really of your household. So safe to go outside, even good to go outside in a way that keeps you socially distant. Let's see. Here's Faye State. I think this one's from yesterday, potentially, from Facebook. If someone lives in a zip code with a lot of cases and the mailman goes to their house before your house, how much risk is there to you when you take out your mail? Okay, so we talked yesterday about, we showed a lot of detail around zip codes and different rates and where we're seeing cases. But I want people to understand that just because you're seeing cases in your zip code, mostly that is really a result of social networks within that zip code. And so where we're doing investigations, I talked about, for example, Chicago Department of Public Health is actually, there's going to be a describing one of the early investigations that we did here. I think it's coming out actually in the big CDC journal, maybe this afternoon. We'll talk about it after it's out. That really just highlighted where even in sort of extended families who are getting together for, funerals or children's birthday parties or at church, some of this was even before the full stay-at-home order was in place, really able to see the potential, just in this cluster, 16 cases and at least 3 deaths coming from what would normally be absolutely a source of strength and, an opportunity for us to really be in touch. And so where I hear a question about, do I need to be much more concerned in my zip code? It's really for everybody in the city, we need you doing the same things around the social distancing, the hand washing, the keeping the distance. And it's not that like the mailman in your zip code has more risk or that mail is worse in any way. Bringing out your mail is not a concern. Picking up your mail is not a significant concern at all. We've said where you bring things in from your home, into your home, again, that risk is very low compared to the risk of being in close touch with people. And if you do a good job of, washing your hands before you touch your eyes, your nose, your mouth, you don't get sort of the virus has to get into your eyes, your nose, your mouth, and mostly it does that through hands. And so I don't want people worried about the mail more in one zip code than another. That's not really the way it works. All right, let's see. Okay, here's one for you. What's an example of a coping plan?
Oh, God, yes. I love these. It totally depends on you. So the first thing you want to think about are what are your strengths? So what do you have in your system? And what makes you feel better when you're feeling low? And what helps you steady? So I'll just use myself as an example. For me, it's very helpful for me to have people in my life who I can talk to who are validators of me, right? That is helpful to me, and then I get exercise. My trigger point would be if I'm unable to use those coping mechanisms. And I would be unable to use them if I was too sad or depressed to get out of bed, if work was too busy, etc. So what we want to do, even in a time where we feel like our schedule's all over the place, whether we're working or not, is project what tomorrow is going to look like and figure out when you're going to practice your coping. Because this isn't like I'm going to do one run a week. This is a constant practice. So for me, for you, it could be I'm not going to do any screen time or look at my phone for the first 30 minutes of my day, and I'm going to practice stillness, or I'm going to snuggle with my kiddo, or we're going to read a book. It's things that make you feel energized and not depleted, and think about when you're going to place those throughout your day. Trigger points are complicated because we all have triggers, but sometimes it's cumulative, right? That's why we scream when we spill something. It's not about the spill. And so thinking about how do we reduce the opportunity to become so full that we are explosive, usually that's by dosing throughout the day. Find people in your network that make you feel better, not worse. I think that that's critically important. I think sometimes we don't ask ourselves that, and now that we're forced to be with each other in our family group more, these are great times to have conversations about expectation. So my expectation of you is I don't want to talk about my day at the end of the day, but I want to talk about this, and this is what I can hold for you, and just making sure that that plan is out there for you.
Okay, great. Here's one. This one's for me more. Ebony Nicole from Facebook. The McCormick Place is designated for COVID patients who don't need ICU care. That's right. It's an alternate care facility, not really a hospital. What happens if their health declines during their stay? Is there a plan to transport them somewhere with elevated care? Great question, and absolutely the answer is yes. So there's a big team on site doing a lot of planning about how this alternate care facility will work in conjunction with our hospitals. We've talked about it's not a standalone hospital where you would come directly there. It's really to help offload hospitals or think about places where we still need isolation for people, but they're not at a point where they would need acute care. But we know that there are people who sometimes, even a little bit into their COVID illness, can get sicker again. And we've seen that even in some of the celebrity cases that get attention around the world, where someone may be at home and sort of doing okay, and then even 6 days in can really start to get worse. And so there are very strong plans in place, and we would be transporting people, and that plan is all written, back to an acute care hospital, to one of our regular hospitals that again is going to be the best setup for people who are having some of that more serious illness. But we're making sure that we have the supplies on place at McCormick if there are more emergent situations, and the training that if there are people who are really not doing well, to make sure that we can do that stabilization, and then think about the transfer. But every day there's tons of conversations about how do we make sure this space is best serving the needs of our hospitals. That is what it is for, to really offload them and provide care. So it's lots of interest there, and I'm sure we'll keep talking about it.
It's remarkable.
Yeah, it really is. Okay, what else do we have? Laura Catherine from Facebook. Okay, this one's for me too. Has there been any progress with a blood test that will show a person has had the virus and has now built up immunity to COVID-19? So yeah, so that is the antibody testing that we've been talking about. So the main test that we do, which is, it's called a PCR test. It's the one that's the nose swab that's really looking for the presence of virus itself in the nose. And then separate from that, there's this blood test that will be sort of more of a finger prick type situation that will be able to look to see, has your body had an immune response to coronavirus? And that's what allows us to really understand, and down the road too, we know that there hasn't been the wide testing availability. We know there are people who have had coronavirus, including here in Chicago, either that have not had significant symptoms and may not have known it themselves, or have had symptoms, but they've not been seriously ill, have not needed to be in a hospital, and in many cases may not have had testing. So we're doing a lot of work to really account for that in the numbers, but then even going back, looking ahead, there will be the opportunity to have some of this testing afterwards to answer some of the questions of who has had coronavirus, even if they didn't know it or they weren't formally tested at the time. So it's one of the biggest things that we're really planning for at the health department. We'll talk probably later in the week or the beginning of next week. We're developing some public-facing sort of opportunities to sign up if you yourself are having symptoms, to be able to be getting text messages back that help you know what to do, and that will be able to link in where there is testing availability, even for vaccine pre-registration, like really thinking kind of in a long-term way, what we can do to support people who are getting ill, help track data, and then use it in advance. So more to come about that. But yes, those tests are available, but still in terms of very widespread use under some development. Okay, so here's another question for you. Oh yeah. So how do we deal with uncertainty or disappointment during this pandemic? Just in my family, we've missed graduations, weddings, events. There's a lot of disappointment. There's a lot of uncertainty, even as people are trying to plan for some of this. Suggestions?
You got to sit with it. I think that one of the most uncomfortable things that we have to deal with is this dissonance. We do not like to not know what's happening next, and we don't like to feel uncomfortable, and we don't like to feel sad. My concern is that we can't numb this stuff. This is hard. This is really, really hard. And talking about it, processing the fact that you're disappointed, hearing about it from other people, but not going to a place where you're chronically numbing all the time. I am really concerned about substance use increase and other things like that.
Yeah.
So talking about it, processing it, knowing you're not alone in this, that we're all kind of living in this disappointment. We're all living in this weird space of I don't know if I have anything to look forward to, because the way that we survive is through these expectations.
Right.
And they're not being fulfilled. So thinking about planning things that you have to look forward to, whether it's group, conversations or writing letters or doing projects. It's not going to replace the disappointment, but I think what we're trying to say is if you have a strong enough foundation, you'll be able to overcome that without that taking you over. And sitting in discomfort sucks.
Yeah, definitely. Okay, Aaron Long is asking, if you live alone as I do and have been socially isolating, is it okay to go live at a relative's house who has also been socially isolating for the duration of this? So, Aaron, I would say it depends a little bit on your situation. Really, especially, we've got this stay-at-home order that goes through the end of the month, through the end of April. We really would like people to not be having additional contact with folks unless it's necessary. So not knowing your particular situation or the situation of the relative that you may live with, it's hard to completely weigh in, because we know that there may be situations where people are needing more help or may have underlying conditions and may need some of that. So I'd say, broadly, we are asking people to try, really at least through April, to to not have additional physical contact with people that you already haven't been in touch with, but recognizing there will be situations where that is needed, and so that's some of the decisions that have to kind of be made at a family level. If somebody has been living alone and really having had no outside interactions, that's a very low risk setting. But is the other person, has that been the same setting, even where you think about coming in and what some of that support looks like? It really is a little bit of an individual decision. But at an overall recommendation, if you're able, at least through sort of the stay-at-home order, to not have that physical contact, it still would be the recommendation.
And I think that question speaks to this really strong desire to have concrete answers.
Yes, exactly.
We want it's like I asked my sister the same thing, who's a doctor, is this okay? It's like, this is complicated, and that's why I think there's these broad stroke policies to protect people.
It is. And broad strokes, the reason we put these in is it's just about trying to do everything we can to flatten and eventually, really see this curve going down, and, any opportunity to not have additional interaction helps with that, even what seems like a very low risk interaction. So that's what I would say. Let's see, Joseph Hernandez is asking, can I just visit my granddaughter keeping social distancing? No hugs, no kisses. So this is another one where, if your granddaughter is not already somebody who's sort of in your household, it's really better to not be visiting right now. We've seen certainly situations, where someone is even outside doors and waving and some of this. Certainly no hugs or kisses for sure right now, but it's really hard for young children to understand actually sort of seeing somebody and not having that physical contact also. And so again, while it's in place, do the FaceTime or the Zoom and the calls and have that, but as much as you can, just to limit being out for those social reasons, even those important family connections. If it's not somebody who's already in your household, that you're not already sort of in your regular contact group, trying to be thinking about staying in touch in ways that keep it physically. So I'm glad you're thinking about the social distancing. People are thinking about how to solve this in all kinds of ways, but it really, you don't want to even be sort of in a situation where you're close enough that you're like, don't hug, don't kiss, right? Because especially with kids, that's really hard for them to even understand. So I know it's hard. It's so hard for everybody.
Yeah, absolutely.
Okay. We've got, what opportunities are there for group support as opposed to calling on an individual level? So I'm presuming this means with social distancing and everything. So
we have virtual support groups every day. Every day during the week. So currently we're operating peer support groups. So when we say peer, it means somebody themselves who've experienced anxiety, depression, mental health issues that are leading this group. We have them free virtually Monday through Friday. We also have a support group in Spanish that is virtual, and for family members, caregivers, people who love somebody who's living with a mental health issue. And then we, like I said earlier, we're starting the healthcare worker one tomorrow, and we will be offering 3 of those. So if you go to the website that Commissioner already discussed, or our website at NAMIChicago.org, and you go under the support tab, you'll see a list for all of our support groups, and we welcome you.
And those are Zoom? What are those?
Zoom.
Okay, yeah. So, and if folks don't have Zoom, it's a free download. And I had never used it before all of this, but I've been using it even with my own family and with others. So, and again, this is getting to, we know there's some digital divide here, and so that there are still plenty of opportunities for people who just have a telephone, but for folks who do have a smartphone or internet access, again, opportunities to have some chance to talk and to share with people who are thinking about some of the same things.
And this is certainly very formalized, our support groups, but know too, if you're doing a group chat or if you have a virtual hangout with your friends, you're also doing the same thing. I mean, you're breeding connection. And when we talked about anxiety as a contagion, think about that when you're having these conversations with your friend. I mean, this isn't about being Pollyanna, but this is about, let's talk about one great thing that happened today. What are you grateful for? And really help people ground. Yeah. What I think is remarkable about this experience is that so many people have the opportunity to increase wellness and resiliency in a way that there wasn't the opportunity before.
Yep. All right. Seeing lots of discussion in the comment box around this is the virus airborne question, which we've addressed a number of times before, but let's kind of review it again now. So broadly speaking, how does this virus spread? This virus is spread by coming out of the respiratory tract of somebody who themselves is infected. So that's through, coughing or sneezing is the most obvious way that people think of. But we've talked about for some of these folks who may be not having symptoms, asymptomatic or pre-symptomatic, that can be something as simple as, clearing your throat, or even, singing has been described as a potential mode, or even sort of an aggressive, something that is pushing virus out in some ways. And a sneeze, people think it's just dust off the keyboard. It still, though, is coming out of the respiratory tract, and it's coming out in droplet form. That's the primary way. And then there have been a number of these studies that have really looked at what happens after the virus comes out. And so this is where, for example, especially in that sort of up to, it's really 3 feet, but we use 6 feet to be broad about it. In that 6 foot radius outside of sort of where somebody is coughing or sneezing, that's the space in which the droplets, the big droplets, are falling to the table, the floor, the hands, wherever it might be. And then this is where there's been some evidence that for some hours in that space, again, very near where someone is, some of the very smallest droplets can be in the air. But where this is concern is really for people who are, especially healthcare workers, who are doing the procedures that are designed to make, like where you're putting the swabs in people's noses, right? To make them, to do the test, which makes them have this forceful coughing a lot out, or people who are intubating or putting tubes in throats. It's really about thinking, that concern for sort of air is really primarily in this health setting. And this is not an airborne virus in the way that like measles is. We've talked about this a lot, where a virus like measles is able to be just in the air broadly to a point where we know that someone who has just been in the same room, right, with someone who has had measles, or someone who even comes into the room afterwards, right? Like for measles, we actually use 2 hours after someone has been in the room as a potential risk factor for someone to come in, because that is an actual sort of full airborne, that's how it's spread. And that's why we've talked about the number of people that are typically infected. And so in measles, that number is like 18 people on average. If you've got people who have not been vaccinated, who are not otherwise protected, one person with measles spreads to, on average, 18 other people, because it is truly airborne in that way. This, again, in the absence of social distancing, all of these things, is 2 to 3 people. And that has to do, again, with the way that it's spread. And so we don't have a big concern, honestly, for being in a general room or sort of having passed by somebody briefly. It's about that contact within that space, and it does come down to the way that this is spread. And so if you actually look at the guidance from CDC and others, where we talk about having the airborne precautions are especially in healthcare settings where you're doing that testing, where you're thinking about that sort of interventional type care. That's really the biggest risk. And for the general public, it's about keeping that distance, doing the very good hand washing. We've talked about that sort of the cloth face covering that people, was added on as a lower level recommendation. That's really about helping keep germs that are in your mouth from going farther distances. Like it's not even necessarily that it stops them entirely from getting out, but it's just about trying to, trying to not have that spread. So I hope that helps clear some of this up. We can talk more details. We can pull out the science again if people are interested. It's certainly been one of the biggest topics of research and discussion and questioning as we've learned more about this virus. Okay, so I think we're coming up on probably our last few minutes already. So I think let's take. Let me just see if there's anything else. Yeah, let's do some good news and some things to do. So anything you want to maybe start us off with that you didn't have a chance to mention, or I want to make sure just if there's anything you want to add.
Good news is there are a lot of people who want to help in this space.
Yes.
The good news is that you are totally not alone in this feeling, that it's hard to find hope when you don't see a light at the end of the tunnel, but this is a moment. This is a long moment, but this is a moment, and we have to remember that and hold on to that. And that when you are feeling overwhelmed by the grief of this, really, that there are people for you to talk to in so many ways. People have really showed up in a meaningful way. I've even felt like this with my friend group that are mothers. You know, how are we connecting and how are we having these conversations to support each other? So continue doing that, knowing that you are in so many ways helping people when you offer supportive ear. So we're excited to see that. And we're excited to see so many free services online too for people to help them with those coping plans, to help them get through the day, to help them exercise and stay healthy. So we're encouraged by the kinship that's being built around this.
Yeah, absolutely. We've seen people stepping up just in all kinds of ways. So I've got a list here. Thank you for people who have been sending these in. So Chicagoans are again gathering using social distancing practices to sing along together. It looks like this time it's going to be honoring the late Bill Withers with the classic Lean On Me. And that is taking place at 7 p.m. on Saturday. It sounds like some of the South Loop group is getting together with Alderman Vasquez's group in the 40th ward, and there's sort of a citywide sing-along. So the idea is neighbors kind of gather on porches with people just that you're living with already. 7 o'clock, sing Lean On Me. So look online, find out more. That's something, if you're interested in being part of, you can be part of it. Also, Cinespace Film Studios has dedicated 20,000 square feet of studio space for helping to store the non-perishable groceries for the many families that are struggling to put food on the table with all of the economic losses that we've seen. It's going to be used by the Greater Chicago Food Depository, which, as we've talked about, there's a lot of spaces, the United Center and others, really working to make sure that we're making sure everybody is fed. So thanks to Cinespace Film Studios and the many, many others that have stepped up from the business community and the nonprofit community to figure out how to do this together. I'll also just note for people who didn't see yesterday that the mayor signed an executive order protecting immigrant and refugee communities specifically during COVID-19. So explicitly said that all benefits, opportunities, and services, anything provided by or administered by the city are accessible for all residents, regardless of immigration or documentation status. So that's everything from the Housing Assistance Grant Program to the online enrichment learning that's being offered through Chicago Public Schools to the $100 million Chicago Small Business Resiliency Fund, really, putting clear into executive order and, into law, if you will, that's open to all. So that was good news, and take a look from yesterday. And then just a note here that someone had also sent in related to the mental health, that there's also, if people don't want to talk to someone, there's texting capability. So an example is, and I think this is on the website, so 24/7, if you just type hello to 741-741, you'll access a counselor who can, again, maybe do some texting or help connect you. There's lots of these kinds of resources available, and we want people reaching out, whether it's through the NAMI helpline, through other resources, through texting. We're all sort of alone, or a lot of us are, much less connected physically, but we want to keep that other support as much as we can. And then I'll just say there was this was something that was happening. My own nephew's neighborhood here in the Chicago area. A neighbor has been sort of taking pictures of things you can see on walks in your 2 to 3 block radius in the neighborhood, and they've been sending it around to all of the kids, sort of a virtual I Spy, so that then when families are maybe out doing a little bit of that, getting outside but not congregating, it allows the kids to actually look for pictures that they were able to see online or even print out. And again, a way to sort of have some of that really very local neighborhood type connection. So we like seeing creative solutions like that. How to, we talked about the bear hunt the other day, where people are putting bears in windows. And again, for kids or others, if you're out, going on a bear hunt, like, see what I can find. So just nice to see some of those things coming up. And I think that is probably a good list. Please keep sending comments, questions, good news stories, pictures. I am out a fair bit and around Chicago, and I try to remember to take pictures myself where I see people just doing a nice job of thanking people or putting up advice or suggestions and signs in windows. We do see that, and I love opportunities to highlight it, so send those in. So thank you again so much, Alexa James, Executive Director of NAMI Chicago. We will continue to, every few days, have special guests on here to talk about particular areas of interest. Like I said, this Friday will be Candace Moore to talk a little bit more about the race equity work here as it relates to COVID. I'm really looking forward to that conversation. And if you've got thoughts of other guests or other types of individuals that you'd like to see in, let us know. I'm definitely planning to bring in some of the behind the scenes workers at the Chicago Department of Public Health to let you know about what investigations and epidemiology and some of that looks like. Definitely we'll be bringing back some healthcare workers again, as we've done. But let us know if there are other types of people that you would like to be able to ask questions of here in Chicago. So with that, thank you again for coming, and really for all the work that your organization is doing. You're not alone. Stay home, save lives, go to the website to learn more. We'll be back at 11 a.m. tomorrow, and we'll answer some more of your especially science-based questions at that time. So have a good day, everybody.